in just about 4 minutes, we're going to be kicking off our second panel, which is possibilities for the future, strengthening collaboration on youth mental health. We have a really stellar lineup of professionals and experts and thinkers that have helped, shape the world as we know it in terms of our response to mental health and well-being. And so I'm going to keep the session going, and just as panelists come on, we'll do the similar show before. Okay, wonderful. Dr. Lukoye, thanks for kicking off this session. I'm going to go on mute, and you guys can kick off whenever you're ready.
Thank you, Leon, for doing a good job with the session. The previous session was wonderful. I really enjoyed listening to the young people speaking about what is important and how to engage young people. So that was a wonderful session earlier today. Now, as the global community reflects on this moment with the crisis that's ongoing, we think that we can, in a way, take advantage of this crisis and start thinking about how to rebuild the mental health systems in the world and how to do things differently in order to ensure that the mental health of our young people is taken care of. And we all know that if we ensure that the mental health of young people is in a good place, then the future of the world would be in a much better place than we have been in the past. So today, we are joined by a very enlightened panel of experts, and every one of them is an expert in their own field and in their own way. And we're going to spend the next few minutes introducing the panelists. And then after that, we'll go into a discussion. And the last 10 minutes of this session, we will take a few questions and answers from the audience. So I am Lukoye Atwoli. I'm a psychiatrist. I'm the technical director of Cities Rise, which, as we all know, is an organization that's working with young people to build mental health friendly cities across the world. We've started 5 cities, and our vision is to reach billions of young people in all cities in the world. I want to ask the next panelist, Dr. Angela Diaz from Mount Sinai, to please introduce yourself. Couple of minutes.
Thank you. So my name is Angela Diaz, and I'm the director of the Mount Sinai Adolescent Health Center in New York City. And it is a program that serves young people ages 10 to 26 with integrated services, medical, sexual and reproductive health, dental, optical, health education, behavioral and mental health, and legal services. And everything is at no cost to the young people. And we also pay for their medication, their labs, and give them transportation, because we want a program without barriers for them. We really want them to come and get served.
Thank you very much, Angela. And I'm looking forward to having a very interesting discussion with you. Norman. Please unmute your mic, Norman.
Yes.
Yeah.
Almost forgot.
Yes, now we can hear you.
Can you hear me now? Yeah. My name is Norman Sartorius. For about 25 years, I was working with the World Health Organization. I was the head of the program there. After that, I worked with the World Psychiatric Association. I'm a psychiatrist and trained also as a psychologist. I'm currently heading a small non-for-profit, non-governmental organization in Geneva, Switzerland. And we've been engaged particularly in training programs for young people, in working on the comorbidity of mental and physical disorders, which is very frequent and usually not recognized, and on trying to bring together people who can speak about healthcare, not only between psychiatrists, but between psychiatrists and other people in the community.
Thank you very much, Norman. And next we ask Yvonne to introduce herself.
Yeah, hi everyone. My name is Yvonne Ochieng. I'm currently the youth lead for Nairobi with Cities Rise. My my biggest joy and my work, my day-to-day work, is to ensure that young people's voices are being heard in the program, but also to connect them with others, with their peers, but also system leaders across the country. I am also a person with lived experience with clinical depression, and I'm also passionate about positive youth engagement and meaningful youth participation in all aspects of their lives. And I'm really happy to be here.
Thank you very much, Yvonne. And now, Jim.
Good morning. Thank you. I'm also glad to be here and want to acknowledge the great youth panel that just concluded. And Leanne, what a great job you did facilitating that. I'm super excited to be here this morning. I'm Jim Vollendroff, and I'm currently the director of the Behavioral Health Institute at Harborview Medical Center. And I work for the University of Washington Medical Center and am their behavioral health planner. But more important than that, I'm a person with lived experience who actually was involuntarily treated in our mental health system as an adolescent, and also live with a substance use disorder. And although I've got these credentials that allow me to do the great work that I do now in the university system, it's my lived experience that I feel that I bring to the table that is one of the most important assets in terms of making sure that people with lived experience is part of public policy.
Thank you very much, Jim. And I think it is obvious then that the panel that we have has a diverse experience and diverse qualifications. And hopefully at the end of this discussion, then we will come up with ideas about how the mental health system will look like for young people during and after this crisis of COVID-19. I want to kick us off by asking a few questions of the panelists, and I'm going to start with Yvonne. Yvonne, we know that during COVID-19 in Nairobi, you've been doing quite a lot. You've been actively running webinars, you've been engaging youth communities in Nairobi, and I have done some of this with you, and so I've seen the amount of energy that you bring and the amount of innovation that you bring. Could you share some of the things that you have done in the city, what you have learned during this process, and one thing or two things that you have seen or experienced that has really surprised you during this pandemic?
Okay, thank you so much, Dr. Lukoye, for that. I'll try. I hope I'll try and capture as much as possible based on the questions that you've asked. So, on the initial stages of COVID-19, when we started experiencing the first cases in Nairobi, what happened is that young people were able to reach out to me and ask, we are scared. What can we do? And how is the future going to look like? So those were some of the questions that I was getting on my WhatsApp, getting calls. I was also getting calls on how I'm experiencing anxiety. What should I be doing now? Who are the professionals? Where can I get services in my community? So those are some of the questions that I kept on getting from all these young people from within my network, but also out of my network. And then we decided with the Cities Rise, of course, it was done globally, to carry out a rapid assessment about the realities of young people in their communities, how COVID was impacting on their lives, and what was at stake. So again, I was able to hear some of them. Some of the realities were like, I'm scared. I can't even go out of the house to eat. I haven't eaten for a long time. I feel that I'm already starving myself. And then I also had something around, I was in school, and now I can't travel to see my parents in the village. I'm just at home by myself. And it's so scary to be by myself. Then the other one was that I can't even go outside because I don't know if I'm gonna get COVID-19. So there's quite a lot of uncertainty that I kept on hearing during this period. And personally, I was greatly affected by this. So I couldn't even imagine me being a person assuming that I have all the skills, I have capacity to maneuver during this period, but it was really tough on myself. So there are a few things that we decided that were very important during this period. One is to ensure, and it came from the young persons themselves. We asked, what do you want during these times? So one was that, I'm distrustful of the government information. I don't trust that information. It doesn't really make sense to me. So we decided to come out with a youthful version of coming out with COVID-19 information. What are some of the risks? What should one do? And how does it impact on mental health? And if your mental health is impacted, what can you do? What are some of the numbers that you can call? We did this with a number of young people in Nairobi, but also professionals within Cities Rise Network. So then there's that one. And then we also had, I want to get connected. One thing that came out strongly is that I trust my peers more than anybody else. So being that I was in a number of WhatsApp groups because of my work. So I was able to bring them and refer them to these WhatsApp groups that served as spaces for them to, to connect with one another, to talk about their experience each and every day. So what we could do is that we had different young persons talking about how the day was, asking people to check in between 6 p.m. and 8 p.m. when all of them were there. And yeah, so that was the second strategy that we were able to put across. Then what happened, we realized that we have so much resources when it comes to network within Cities Rise. And as we talk about professionals. So I was able to reach out to them, and of course, with Lukoye, we decided that this is the time, because young people usually are ever scared of these professionals because of the mentality that has been created within the mental health field, that only some people should be, only some people are affected by mental health field. The professionals are not good people, or they're scary. So we thought it was also a very good opportunity for collaboration to bring a wealth of experience from these mental health professionals that we already working with. So personally, we had not had so much collaboration between young people and mental health professionals. And within the program, we had tried to figure out that. So this was a great opportunity for us to connect them. Then there came the weekly webinars that I decided to organize. So we organized these webinars whereby it's more of a question and answer session, whereby these young people ask mental health professionals, but also other young people about their experiences, about certain topics that are so much related to COVID-19. So we've been talking about how do you cope with your emotions during this time? How can you think positively? How can you create your boundaries during this period? Because we also had many young people saying that I'm now at home with my parents, or I'm at home with my siblings who I never see. How is that going to be during this period that we are all in one space? How do I get to communicate with them? So we thought this would be a very good platform for young people and also mental health professionals to interact, so that it's not just during COVID-19, but also after COVID-19. And what I learned during this period is that there was so much learning that went on between, of course, mental health professionals and young people. There's so much positive reception among both of them. And there's some mental health professionals who kept on asking me, oh, can I join the next session? The other one was so great and all that. So it felt like both the young persons were learning, but also the mental health professionals were learning on how they should be interacting with young people if they ever want to give out services to them. And it also acted as a space for them to be referred to services. So during this period, the government of Kenya and other organizations put up so many call line and helpline numbers. So we could, it was also a very good platform when young people inbox me and ask, like, so what do you think? I think I need more services and all that. And after this, so I was able to refer them to services, specialized services that they needed during this period. So, and I definitely think there's such a huge momentum that is already taking place, and mental health definitely has been not put at the back burner, but at the front burner, and everybody is talking about it, which is something that we've been talking so much about and wanting to happen.
So I'll have you hold that thought right there, because that will be something that I'm going to come back to you to now start prognosticating and telling us based on this experience that you have had, what does the future look like? So I'll come back to you, but I want Norman to jump in here, given that you know, a lot of changes are happening, and Yvonne has pointed to some of the things that are happening now that are probably being catalyzed by this pandemic, like the interaction between professionals and young people. A lot of changes. Do you see, Norman, that there is a hope for us to build back better than we were before? And in building back better, how can we, as professionals, collaborate better with the people that we serve and with young people in order to build back better after, during and after COVID-19? Norman.
Well, you shouldn't ask an optimist about hope. Of course there is hope, and a lot of hope. And I think that the hope is supported by several factors. Number one, I think this pandemic, terrible as it is a terrible, important reminder that we are going to have to face similar catastrophes in the future as well, and that we should be ready for facing them, better prepared than we were this time. Somehow, in the last 40 or 50 years, we've been sort of living thinking that technology is advancing and everything is getting better and richer, etc. But I think it is a terrible reminder that things in the future may again happen. Maybe not with a virus of this kind, but some other virus, maybe the climate change or other catastrophes like that will happen. And I think that we have learned a great deal during this one, which we can use in the future. One thing that we learned, particularly in countries where confinement was the case, was the most important messages that one can learn for good life. Number one is how to be alone when you are confined. And number two, how to be with others when you get the chance to be with others. And I think that those two lessons are of tremendous importance for the people because they tended to forget them a little bit. Now, we've also learned during this period that practically none of the countries, no matter how rich they were properly prepared for facing a catastrophe of this type. And that there were various excuses, but I think that we will have to avoid those excuses and think in the future of ways in which we can prepare ourselves. There was one phenomenon in this catastrophe which was very clear, and that is everybody was saying the government should do this, and these people should do that, and somebody else should do something else. But I think that we will have to gradually learn that it's not what others should be doing that we should worry about, but we should worry about what we ourselves should be doing and where is our responsibility to help in such a situation. So that sense of being co-responsible, being responsible for what will happen and what we can do in the future is very important. I think that another point that is of importance is that if we've heard from Yvonne, and I think you will hear from other people, there are numerous solutions that people have found. And these solutions give us a great selection of possible answers, which people can select for the future. They should be described, and we'll have to make a special effort to describe them in sufficient detail to be able to imitate them. Because the notion that we can have a global answer for everything is not possible. We'll have to have answers which are strictly designed, tailored for different situations. And if we have a large catalog of solutions which worked, I think it will be incredibly important. It'll be much easier to work in the future when we have that in our hands. Maybe one other point that is important as well is we have also learned from reports how much more difficult it is to look after people who are sick when you are isolated from everybody else. When there is no way to reach the health service, and you have families that in particular been very clear about the tremendous increase of burden which they have experienced when they had somebody who is sick and for whom they had no possibility to ask for anybody's help to help. So we'll have to think of ways in which we can help each other despite of the confinement and similar solutions that we will have. One clear solution for that has been the sudden popularity, even more greater popularity for telemedicine, and for thinking about ways in which telemedicine can be used in solution in helping people who are alone and not well. Another solution that has been present as well has been voluntary organizations that have sprung up to help people. And I think all of these are creating a large number of options which we can select and use for the future. So I think that to answer your question, I have a very strong hope that we will be better prepared for the future, and that we will probably remember many of the things that we did and be able to use the knowledge which we have gained to improve the life of everybody.
Very good. And the question about hope and the future was very deliberate because you as you say, you're an incurable optimist, and and you keep looking for reasons for us to keep doing better and to keep improving what we're doing, because there is a future and we will be part of that future, and so we have to build it better for ourselves. So thank you for those.
Even if when I, for a chance, sometimes I get a bit tired of being an incurable optimist, and then I become a cheerful pessimist. I think that despite of the troubles which we have, there are very often, in every evil situation, there is something positive, something useful that you can pick up and use in future work.
Absolutely, absolutely. And that then segues very, very well to what Angela is doing in Mount Sinai. Angela, you've been working to create new systems of support for diverse youth communities through your work at Mount Sinai. And we will be interested to hear about the approach that you take to meaningfully support these young people, and then to also share how this is changing in the face of COVID-19 in New York. And finally, then something unique that you bring to this table about the role of love when working with young people. And we would be interested to hear from you why you feel love is very important when engaging young people and in doing the kind of work that you do. We are moving from hope and we're going to love now. Angela.
Thank you. So our approach is a biopsychosocial, cultural, a spiritual approach. So it's a very, it's not just seeing patients, it's seeing people, serving people, very holistic. And we do the work in the frame of positive youth development, social justice, and achieving equity. Our program has been around for over 52 years. And everything that we have learned, we learn directly from the young people. So we ask them, what is it that they need? How is it that they want it? What are barriers that are going to keep them from coming? What are facilitators that are going to help them come? And then we use that to design the program. So we basically design the program together based on what the young people say they need and want. We have 4 different ways of providing mental health. One is, and everything that we do is youth-friendly, patient-centered, that's all we do. But one of the model is the more traditional model where people come for an intake, they get assigned a therapist, they come every week or more often if necessary. We also provide services in a model that we call primary care. So we have mental health professionals working side by side with a medical professional. And the mental health have a flexible schedule. I'm trained as a medical doctor. And so if I'm working with a young person and I see that they can benefit from mental health, that same day, I connect them to the mental health professional and they get the services that they need right then and there. It's not I'm going to refer you, come back, and the young person doesn't have to get anxious, because I introduce them seamlessly to that person. They see that it's a great person and all the barrier is removed, and then they can come regularly. And then there are some group of young people that we work with for whom that primary care mental health flexibility is really important. Like we work with young people who are survivors of human trafficking, for example. And we know that they cannot just go to their trafficker and say, I have my 2 p.m. Tuesday appointment at Mount Sinai, right? It's not how it works. But they will come for something medical. Either they have an illness or they think they're pregnant. So every time they come for that medical visit, we give them an infusion of mental health. And we help the young person heal and deal with their trauma and get stronger. in many, many ways. And then the other thing that we do is that we have full-time clinics inside 6 high school buildings. And through those, we serve 24 high schools and middle schools. So right inside the school, we also have all these really flexible services, including mental health. And the fourth way that we work with them in sort of mental health, mental well-being, is a mind-body way, exercise, yoga, healing, everything, and sometimes through the arts also. So those are the models that we use. What we are finding with COVID-19 is that we did a survey with our young people, and 65% said that they have much more stress since COVID began. Some of them are overwhelmed with their anxiety. They cannot focus on anything other than their anxiety. And many say that they are more depressed. 37% actually meeting the criteria for clinical depression. 41% said that they have used marijuana recently, with 22 using it every day. Smoking went up by 51%. Marijuana went up by 41%. And then a lot of interpersonal violence also increased, and domestic violence and human trafficking and forced sexual trauma. So we are seeing a lot. So the need of young people in terms of mental health is going to expand. And I'm actually getting ready to do that. What we did with the pandemic was that we divided our medical staff into teams, A, B, and C. We are open Monday through Saturdays. We decided to stay open for in-person services because we knew that young people with school closed, no after school, no sports, they will need a place where they can come and be seen, be heard, be supported. And then those teams, A, B, and C, one of those teams come and work for 3 days, then they go and work from home for the week. But we always have one of those teams here physically. In terms of mental health, we have people in person for in-person services and in the clinic, Monday through Saturdays. But we also bought a whole bunch of iPads and iPhones for the staff to do telehealth. And what is interesting is that the staff are saying that they're serving more kids and there's less of no-shows. And some, most of the youth really are able, at least in New York, to get those services. And every so often, you need confidentiality because we talk about very intimate issues with a young person, and you have sometimes a lot of people in one apartment. So the youth may need to go to the bathroom and lock the door. But we just work with them wherever they are. In terms of love, if you say to a young person, why do you go to Mount Sinai? They will say, oh, because I feel welcome, respected, not judged, connected, safe, and accounted for. And I will say because we love them. And humanity needs love. Children and youth thrive with love, and they do not do well without love. I really think that love is the essence that really feed their soul, their sense of self, their being. So we all need love, and many of these young people, they may not have that in their daily life for a number of reasons. So I think that also is part of the equation and help them heal. And the young people keep coming here for years, and they do beautifully. We have amazing outcome, or they have amazing outcome, I should say. And that's the nature of the work.
Lovely. That's. I think somebody has even indicated that is just beautiful. That is something that would make anyone who needs to speak to someone want to come to your clinic rather than go somewhere else. So that's powerful.
And I just want to say that I was a patient here when I was a teenager, like the other people with lived experience. And I was a high school dropout. And it was the mental health services I got in this clinic that helped me get back to high school and then college medical school. I would not be here without these services.
Amazing, amazing. And that's a powerful story. I think it is something that then motivates any young person coming there. They would be motivated that they can also, do just as well as you have done and come back and serve people the way you're doing. So that's powerful. Thank you very much, Angela, for sharing your story. Yeah. Now, Jim, similarly, I think you have a powerful story of recovery. And you indicated that you have interacted with the mental health services in the US in your lifetime. And now you're working to support the mental health of young people. Is there a story of your own experience and what it taught you and how the mental health care system needs to change, particularly to serve young people better? And secondly, as you address that then, there is this area of collaboration which you, at the onset of this COVID-19 crisis, you took on the responsibility of coordinating and collaborating with cities across the world through a command center. So I would be happy for you to tell us how your work that you have been doing with young people in mental health pivoted during the COVID-19 period to the command center and some of the key outputs from that process. Jim.
Thank you, Lukoye. I am so pleased to be a part of this panel, and Dr. Diaz, to hear your lived experience and your experience being a patient in the very system that you are now involved in is heartwarming, and that's similar to my experience. I was the director of the very organization that involuntarily committed me as a young person, and now I'm the behavioral health planner for the very hospital in which I received my services. And so it just shows the power of recovery and what people who are struggling can do given the right environment. And that's what drew me to Cities Rise. And when I first met Motri and I heard her vision and I heard her passion and how she talked about mobilizing young people, I just knew I had to be involved. I've also struggled with depression, as I mentioned earlier, depression, anxiety, and substance use disorders. And on top of that, I'm an optimist regardless of all of that. And so it's an interesting combination of having depression and optimism and at the same time, but somehow I manage that. And I manage that through several things that were already mentioned. I love the fact that we talked about hope. I love the fact that we talked about love. And the thing that I would add to that combination is gratitude. Hope, love, and gratitude are the things that actually keep me thriving in my recovery and keep me wanting to work with young people and help them move from this place of just surviving. I am not satisfied with young people surviving. I want young people to thrive. And survival might be the place to start, but in order to live a full and vibrant life and to give back to the community in which they live, young people need to be helped to thrive. And one of the things that Motri and I talked about early on was I'm convinced that young people, and I speak from the heart and my own experience, I didn't realize the potential I had. And I didn't realize the potential I had because of the challenges that I had. And so I was connected to the community behavioral health system after a number of suicide attempts as an adolescent. And it was great therapists at the community level who helped me understand my potential. My parents never went to college. I never even thought I could go to college. But when somebody started introducing me to the fact that, Jim, you have potential. You have the opportunity to use your lived experience to help other people thrive. It was an incredibly rewarding experience, and I'm thankful that my lived experience can now be used as part of public policy. I've been in this business for a long time. Obviously, I'm no longer a young person. However, I worked in this field for 30 years before I ever told anybody that I was involuntarily committed in this system or that I lived with a substance use disorder. And it was shame and stigma and all these things that kept me back. But it was the most liberating thing the day that I discovered that that could be power and that it could also be part of my experience. So I'm extremely grateful for that. Earlier on the youth panel, one of the panelists said something, I'm probably not going to get this right, Nia, if you're listening, but it was something around that America has a mental health problem. And I truly believe that. I think that if we are able to address this issue and challenges that we have in this country by being part of a global community, I'm interested in being a part of that. That was another reason why I was so intrigued by Cities Rise. I am convinced, Seattle, I'm in Seattle, Washington. Seattle's a diverse community. We have people from all over the globe living in our community, and I'm convinced that the Western approach to behavioral health is not the only solution. And so I'm interested in what's happening in India and Africa and in Colombia and elsewhere in the world that's working to help people thrive in their communities. And when I'm sorry, Lukoye, I'm probably not answering all of your questions directly, but I will get to, thank you. Well, I'll get to that last point in terms of the command center and what we've learned and why we did that. When the pandemic first occurred, I know enough young people, and I began to see, and I've been involved in disaster planning. I'm not sure how many of you are familiar with the terrible Hurricane Katrina we had 20 some years ago here in the United States, in which New Orleans was devastated by this massive hurricane. Well, I went to New Orleans after that, and I went as part of disaster planning. And young people and community members that I talked to said to me, you guys knew as public officials that this was a likelihood, and that if you didn't do certain things, that there would be problems. And that's always stuck with me. You knew this was a potential. Why didn't you plan for it? And so when the pandemic hit, it was clear to me, we need to plan for this because this is a major problem. And I could see early on, this was not going to go away overnight. This is a long, and we're seeing now that it's probably even longer than I anticipated originally. And so we quickly decided that we needed to mobilize as communities and find out what young people were experiencing. And Dr. Diaz and other people on the panel have already shared what they're seeing. And it's no different than what we're seeing. We're seeing increased anxiety and stress, and living and being in proximity with family, as Yvonne mentioned, when that's not necessarily people's experience. They're able to get out and be free, but now they're confined. There's just a lot of challenges that young people are experiencing, and what I also found though was resilience and willingness to engage and willingness to come up with solutions within their own communities. And I've seen young people reading books together online and using technology. Norman mentioned telepsychiatry. I've been involved in a project about how to make telehealth more readily available, but it's not just telehealth, it's other digital opportunities to connect people and keep people connected. I've seen young people meet in groups and watch movies together. I personally have learned a lot about technology from the young people that I've engaged in. And so it's great to see the resilience of young people as a part of this solution moving forward. And I'm just, again, blessed to be a part of this. I want to just end by saying, that young people need to be seen, and young people need to be heard, and young people need to be involved in the solutions. And on the youth panel, it was talked about this propensity for us to bring young people at the end and get their blessing and have them, say that they were a part of it when in fact they weren't. And so young people and people with lived experience need to be at the table when programs are developed for and by them. The behavioral health challenge that we have, both mental health and substance abuse, is real, but it's also treatable. And it's also, I love the notion of the environment that was talked about. I too believe that the environment needs to be welcoming and engaging, and it needs to be centered toward the age of the persons that we're serving. I learned early on to stop focusing on what people need to stop doing and talk to people about what they need to start doing. I don't talk to young people about stop doing drugs and stop hanging out with your friends. I talk to them about starting doing different things that maybe they haven't tried before. And I think that approach gets us a lot further. So I'll end there.
I'm going to hold you there, and I'm going to pick up from exactly what you have said, because now I'm looking at the future. After this COVID-19 crisis and how it is changing the world, I'm picking from what Jim has said, so that we don't talk about what people should stop doing, but we start talking about what should we do differently as we go forward. And I'm going to start with Norman, so that based on what has been happening and what we know about mental health and what we have learned and what we are learning during COVID-19, what should we start doing differently? Norman. You need to unmute yourself, yeah. Yeah, great. Go ahead.
Well, I think that one thing that we have learned people have talking about youth doing something and the elderly should do something else and somebody else should be doing something else and people in Africa should be doing something and people somewhere else should be doing. I think that is absolutely true. Everybody should be trying to develop something that is in harmony with their capacity and their interest. But at the same time, we should think of ways in which we can bring these different groups and different streamings together. We should seek a unity in diversity in thinking about the future, because it will be much easier and better if we can consider and give respect both to the young and to the old and to the others and to, I don't know, all of these subgroups which we now have. Having separate groups in a society which each drive their own agenda is not the way to go forward. We have to find a way, a common language that will allow us to talk to other people and to listen, and above all, respect what the others are doing or want to do. So that is one, I think, future perspective that I would like to underline. The second perspective, I think, is that that we should probably think about being very happy with the achievements and not dwell too much on catastrophes and problems that we have encountered. We should think of the solutions and trying to improve those solutions as we go along. Maybe there is also, it's important to consider just what Jim has said about the possibility of using the modern era of technology, not only for telemedicine, but really for other forms of being together and helping one another and listening to one another. I think that that is something that is, I remember many years ago in Lesotho, the doctors were very alone and separate and very unhappy, and many of them depressed because they worked in complete isolation from one another in the country. And somebody invented the notion that 1 hour a day, they should be talking on radio to a central station. And it was an unbelievable change in their lifestyle, because suddenly they had one place with which they could communicate. It was a place that had experience, that other people would share their problems, etc. And I think that the modern technology will allow and facilitate people getting together, communicating much more, and being together in doing things for the future. Maybe one other point that we are likely to forget is to describe very clearly the almost like a log, not only what we have successfully done, but also what we failed when we tried to do it, so as to have that in our hands in preparation for the future problems that might arise. And then a fourth point that might be of importance as well is, you know, I listened also to the previous session and remembered, like Jim, that America is a mental health problem, but I would expand this a little bit. I'd say that all countries in the world have a mental health problem. And it would be very helpful that they think about the ways of solutions, ways of solving it. Some of them have a problem that is related to their past, some of their current, some other problems. There's something terrible happening with the sound. But I think that recognizing that problems exist and trying to find solutions together would be very important. And in the same way, as I said, that it's within a society important to search unity in diversity, it is also important internationally to think what can we learn from Kenya, and what can Kenya learn from America, and what can various countries learn from one another, not only at a government level, but a much more small level of people who should speak their voice, speak their experience, and help others to overcome problems.
Thank you. Thank you very much. So the big lesson I'm picking from here then is how we do these things differently, is to stop segmenting society, stop segmenting groups and saying, doing this for this group, doing this for this group, but finding solutions that everybody feels they have ownership for and they have contributed to, and that can benefit them if they put them out there. And we can only accomplish this by planning together, and therefore including young people, including the old, including everyone else in the planning phase, so that we all contribute to this. I see Angela is nodding her head, and I'm going to give her a couple of minutes to say something also about how we can do things differently going forward based on the lessons we've learned.
Thank you. I want to share that we are doing a monthly survey on our youth to see the impact of COVID-19 on their lives. And something that we are finding out that they are reporting is that 33% of them lost a loved one. So those are major losses. And we are putting in place additional services like grief and bereavement to help them with that. The other thing is that I think it's really important that even though families or young people need to be physically separate, they need to be emotionally connected. So we really need to, as human beings, we need to be connected, and especially youth. So social is very important to them. And some of the things that we're doing is that we have peer health educators. So we have youth working with other youth, and we have a video, developing video to help other young people, it's young people to young people. So they're just helping each other together. And I think it's really, those things are just very, very important. And young people are very courageous. They work so hard. They thrive, they're resilient. They have to reach the promise of youth. And we all need to do that work together. And I love that the panel is global, because we are learning from each other, and I hope that we stay connected. And I just want to say thank you for allowing me to participate.
Thank you, Angela. Just one question which you answer very quickly. The services you're offering in Mount Sinai, are they available to everyone, or are they for a select group of people? Somebody is asking on the Q&A whether these services are available for all age groups, regardless of medical coverage.
They are available to any young person aged 10 to 26, even if they live in other places. They can come from Africa, they can come from wherever. And everything is at no cost to anyone. They don't have to have insurance, any person. They just need to be that age group. And if they have children, we also see their children. So if a young person have a child, we see that child from birth. And if the young person needs family therapy, we do the family therapy with the parents and the siblings and whatever. But everything is around a young person aged 10 to 26.
Lovely. Thank you very much. Jim, as we go towards the tail end of this discussion, a couple of things that you think we can do differently, having learned from this COVID-19 and looking into the future of mental health for young people?
Thank you. It's a great panel when you feel like you're really just an observer, and I just love hearing everything that's been said so far. So thank you again for having this discussion. I want to just go, I've been on a one-person campaign, feels like sometimes, to change this term of social distancing to physical distancing. And Dr. Diaz touched on something that made me think about that. And I think it's incredibly important, and it's a small term, but we don't want people to be socially distant. What we want is people to be physically distant. And it's incredibly important right now that we are socially connected to as many people as possible through technology and other means. And I think that making sure that we do that is important. Although I'm an optimist, I'm also a realist. And I'm a realist in the sense that there are incredible inequities in our country and this world. There are a lot of haves, and there are even more have-nots. And how do we bring that gap closer together is what I'm committed to do. And I think that there's an opportunity here, frankly, with COVID. I mean, it's a terrible pandemic, and we're in a terrible situation in this world. But through, who was it? Winston Churchill, somebody said, never waste well, I can't remember the quote exactly, but never waste a bad problem or whatever. And so let's take advantage of this opportunity, and let's think outside the box. And young people have to be at the center of that conversation and leading the way, so that we can, really make those changes. In the youth panel, somebody said all systems have to change, and I totally agree with that. The legal criminal system. We don't. And a new term that I'm really pushing too is not calling it the criminal justice system, because there's nothing just about our criminal system. It's the criminal legal system. The criminal legal system has to change. The education system has to change. The treatment system has to change. So let's take opportunity during this time of pandemic to bring young people to the table. We've seen it with the Black Lives Matter movement, you know, that if we harness the power of young people, they can make these changes. And I want to be a part of that. And I think we have an opportunity to be a part of that globally.
Absolutely. Thank you. Thank you very much for bringing this. And therefore, Yvonne, young people must be at the center of it, and we must enhance connectedness, including using technology and avoiding telling people to be socially distant, because that sounds so cold. So can you take us away with what should we do differently going forward, given what everybody has said?
Yeah, just to build on that is that apart from just getting people to connected with their peers, but we also want to be connected to resources and also services within your communities. So the services need to be affordable, and they don't need, we need not to have discrimination within the services. We also want to have, like we've said, young people, when I guess all the panelists and the previous panelists, when given those resources, they can be innovative enough to come up with their own solutions. So also ensuring that those young people are not only tokenized, but also given resources. And when you talk about resources, it does not just giving them funding or money or around that, but also giving them, empowering them with skills and capabilities for them to come up with the solutions that they think can work for them. So the last one has to do with investment, in general investment in mental health. Because I guess, like Norman said, mental health is a world problem, but we need more investment. Because I believe that whether we talk here amongst ourselves and say young people need to be at the table, we talk about services, but if we don't talk about investment in youth mental health, then we'll keep on talking about this conversation each and every time. And we talk about smart investment, whereby it's people-centered, it's youth-centered, when it comes to services, when it comes to programming. Yeah. That's it.
Thank you very much, Yvonne. I want to ask Angela again, from the Q&A, there's clarity required about the fact that the services you're offering are open to everyone. Maybe you just need to add a clarification that it doesn't exclude anyone. Is that accurate, or does it exclude those with insurance, for instance?
No, it excludes people who are not 10 to 26.
Okay.
They have to be 10 to 26. They don't have to be documented. They don't have to have insurance. They don't have to have money. They don't have to even speak English. We work in different languages, and we just accommodate. If you are 10 to 26, you can come here. Whether you have insurance or not, we cater to young people that do not have insurance, because we know they have no access except for maybe the emergency room. But we serve everyone. We think that young people have the right to be served, to do well.
Thank you. I hope, Ali, you're satisfied. We have clarified this, and this message can be sent out to the young people in the New York area who can reach Mount Sinai, that the service is available to every young person, no matter their status. There's a question that has been asked about young people who have chronic diseases. So there are, in many countries, I believe, advisories that are telling young people that they need to stay indoors, stay away if you have diabetes, if you have other chronic illnesses, because of your risk of mortality. I do not know who on the panel wants to take a go at this. How do we then deal with these young people who need to get out there and get services and get things done for them, but they have a chronic illness and they're scared of getting out, and they're being advised to stay indoors? Is there any panelist who feels like addressing this?
Well, I can talk about, I guess, New York, because that's what we are saying to young people and to everyone, that now they really need to come back into the healthcare system, because at the peak of the pandemic, and New York, as you know, is the epicenter of COVID, especially in March and April, and even May. But now people really need to take care of their chronic diseases. They really need to go back and get their immunizations. They need to get their family planning if they need that. So we are actually trying to encourage people to come back into the system. They need to wear the mask, keep the physical distance of at least fit from each other. They need to take care of themselves. But it's very important to get their needs met medically, especially if they have a chronic condition.
All right. And so, Norman, you want to say something about this, and then I'll give everyone a minute or so to give closing comments.
Well, only to say that it's the young people who have another problem, physical illness, for example, or anything of that type. They are really belonging to the group of other high-risk groups in the society. And whether this is elderly people or people with diabetes or people with cancer or people with a whole range of people have a higher risk. And there should be a clear strategy which will help people with higher risk in this particular situation. And that principle of identifying people at higher risk is terribly important. We will now very soon, I think, face a situation in which the vaccines will become available, but they cannot be available at the same time for everybody straight away. So we will have to think of what is the order in which we are going to offer vaccines, for example, to people. Is it the health workers who should get them first, or people who are sick, or people who have the highest mortality chance? It's something that we have to resolve, but undoubtedly people who are at increased risk, whether young or any other age, require specific attention and specific thinking about how to help them. And there are various ways and very good experiences on how to do that.
Thank you very much. Isabella Osiemo advises, I think, Lian and the rest of us that going forward, it will be useful to have somebody doing sign language, because there are people who are hearing impaired and who still like to follow this. So either sign language or closed captions or something, so that people can follow the discussions. I think that is well taken. I'm going to ask each of the panelists to take a minute to make closing comments, and I'll begin with Jim.
Thank you. I want to address a comment that I see in the chat, and it's about Black and Indigenous and people of color and workforce. And I want to make a quick plug for a conference that we're going to host in the fall here in Seattle that's available globally. And it's around race, mental health, and social injustice. And we're hosting this panel, and one of the components of it will be a workforce component, because we are very concerned about the lack of diversity in our provider networks and people being able to see people like them for treatment. So I think that's an incredibly important question and comment that came up. I just want to end with saying that I do believe greatly in the power of recovery. I live it every day. I think that hope, love, honesty, gratitude, being of service to other people are incredibly powerful tools, despite some of the challenges that we face. And there, as a matter of fact, to me, they're the antidote, if you will, to some of the despair and the challenges and the inequities in the system. And I am committed to bringing young people to the table and having them heard with genuineness and being at the center of the conversations. And I'm thankful for being a part of this panel this morning.
Thank you very much, Jim. Yvonne, in a minute, what would you like to close with?
Yeah, I would like to say one is that I know it was said before, but we should also look at this pandemic as as a yardstick for our public health systems. So we should not see mental health right now and not talk about mental health as when the pandemic comes to an end. It's supposed to be an ongoing conversation that we talk about within ourselves, amongst ourselves, in our families, in our homes, in our schools, and ensure that we live by that. And then the other thing that I want to say is that to young people, if you're told that you're going to be put at the center at the table, you're going to be given a seat, and you're not given that seat, please bring your seat to that table and sit there and talk about what you want to talk about. Thank you.
Absolutely, absolutely. Bring your own seat if they don't give it to you. Angela.
I think we need to address racism, front and center, whether it's structural, institutional, interpersonal, or internalized. And it, you know, for Black people, for us people of color, it has been around for over 400 years. For Native people, over 600 years. So it's going to, it may take time, but we really need to do that. The other thing is that there needs to be a commitment to equity in every system, in every organization, in every community, and really redistribute the resources in a way that is equitable so that we can come to that. Young people need to be at the center of solutions, not at the periphery. You know, they are the experts of their lives. They know what they need. And I just want to make one quick point. For the young people that we are surveying, only about 30% said they will take the vaccine. So we also need to educate young people and communities. And I think they say that because of the history of abuses in the healthcare system, immunizing people of color, or not immunizing them, or not treating them. So we have to build trust, awareness, and really help people understand that if there's a vaccine that is safe and great, it would be important for them to get for their own well-being.
Thank you, Angela. And Norman, in a minute, you have to unmute yourself first.
I have 3 points for 1 minute. One, I don't like to say this is a closing discussion. I think it should be an opening discussion, both for our working together and I think for bringing perhaps the results of the earlier panel and of this panel into some kind of forum which people who have not seen it can see it again, maybe in a publication, maybe in a diskette, maybe in a link to which people can relate. And then maybe that could act as an invitation for other people to express themselves and to learn about it. My second thing is I want to express my thanks to City Rise and to the organizer. I think it was a wonderful idea to do this, and I hope it can be repeated. It may be an extra effort, but I think it's worth the trouble. And finally, the last one is, I think, since we are speaking of various countries, it's the Chinese sign for crisis, which is composed of two signs. One is a sign of danger, and the other one is the sign of opportunity. Every crisis has an opportunity. And I think that the COVID crisis gives us an opportunity to learn how to deal with crisis in the future.
Thank you very much, Norman. And as I conclude, then I want to thank all of you for the very wonderful participation, for very critical points that you've brought on board. And I will close by using the three things that Cities Rise does, enhancing coping, which we have really addressed here on how we can do this for young people, creating a caring ecosystem, which Angela has described very well, and Yvonne has done that as well, and connecting, which we have all addressed and talked about physical distancing and social connectedness being maintained, and hope, which I have had a lot of, and love. Jim, you had added there was hope, love, and helping other people as well, being connected in the community. So I think we have gotten great messages from this, and as Norman says, we will compile this and find a forum and a medium in which to disseminate, so that those that have not been able to participate are able to feed off the gems of wisdom that we have picked from this. Thank you very much, panelists, and have a wonderful rest of your day.
Thank you.
Thank you.